Hey guys, so I decided to do my master's project on Addison's disease, and I hope you guys learn a little bit more about it. So background for Addison's disease. Addison's disease is an autoimmune endocrine disorder that affects a minority of people across the globe. One of the most famous cases of someone with Addison's disease was President John F. Kennedy. Addison's disease, or primary adrenal insufficiency, is caused by autoimmune adrenalitis. Autoimmune adrenalitis results in the destruction of the adrenal cortex. Risk factors include cancer, tuberculosis, and other autoimmune diseases. Clinical presentation and the assessment of Addison's disease. So the signs and symptoms of Addison's disease have a direct correlation with the depletion of the glucocorticoids, or the cortisol levels, the mineralocorticoids, or the aldosterone levels, and the androgen levels in the adrenal cortex. Some low cortisol symptoms include weakness, fatigue, anxiety, and GI upset. Symptoms of low aldosterone levels include orthostatic hypotension and salt cravings. In some instances, sexual dysfunction can occur in women due to the low androgen levels. And one of the most distinguishing signs of Addison's disease is the skin hyperpigmentation that's due to the high levels of ACTH. And just on this slide, I have just kind of a visual picture that usually helps me remember the signs and symptoms of Addison's disease. The next, diagnostic studies that are used in Addison's disease. And on this slide, I kind of just have a flow chart that kind of makes it easier, at least for me, to kind of have everything in order. So several tests obviously are utilized in the diagnosis of Addison's disease. A basic metabolic panel will reveal hyponatremia and hyperkalemia. The plasmin renin levels will remain high while the aldosterone levels remain low. Patients with Addison's disease have a low morning cortisol levels since cortisol levels decline during the day. The next step in the determination of Addison's disease is an ACTH stimulation test. The cortisol levels will be measured at 30 and 60 minutes after the ACTH administration. So patients are diagnosed with Addison's disease if the cortisol levels remain low and the ACTH levels remain high. Treatment of Addison's disease. Basically, the mainstay of treatment of Addison's disease is glucocorticoid therapy, so steroid therapy. In some instances, some patients with Addison's disease may require mineralocorticoid or androgen replacement therapy. Mineralocorticoid therapy, the example of that is fludrocortisone, and then of course, androgen replacement therapy. So prognosis and complications of Addison's disease. The most deadly complication of Addison's disease is adrenal crisis. Basically, adrenal crisis is when the adrenal glands are non-functional. Adrenal crisis can lead to hyponatremia, hyperkalemia, hypoglycemia, and hypotension. Other complications of Addison's disease have to do more with the corticosteroid side effects. So like I stated in the slide before, corticosteroids are the mainstay of treatment in Addison's disease. So corticosteroid side effects include sleep disruption, increased appetite, weight gain, and osteoporosis. It's also recommended that patients with Addison's disease should carry an injectable form of corticosteroids, as well as wearing a medical tag or having a medical card for emergency situations. And it's very important that patients with Addison's disease should be educated on their condition to avoid life-threatening consequences such as adrenal crisis. Lastly, I have my references that I used for my paper and for this PowerPoint presentation. So I hope you guys learned a little bit more about Addison's disease. Thank you.